Welcome. Low back pain, sciatica, herniated discs, bulging discs, degenerative joint disease, arthritis, piriformis syndrome. I saved that one for the last, piriformis syndrome. So commonly misdiagnosed. With all the hundreds of thousands of diagnoses made with herniated discs, bulging discs, and arthritic changes, many physicians are missing this piriformis syndrome because of the fact of our stresses, from the way we sit, drive, bend incorrectly, weak core, as well as many of the activities we contribute with stresses being put into the ligaments, joints, and muscles. That's one muscle that likes to cry a lot. So what can we do to help that piriformis muscle? What can you do at home right now to take away some of that stress, to release it? Why do you need to do this? If you look at the lower vertebrae here, you have 5 lumbar vertebrae. Lumbar curve going inwards in the lower back, outwards, mid-back, inwards, back in the neck again. Lumbar lordosis from the side going inwards. What happens down in the pelvis, as this pelvis becomes imbalanced or becomes excessively stressed, a particular muscle called the piriformis muscle, as you can see here, that muscle goes from the bottom part of the sacrum into the thigh, the top of the thigh bone, okay, up in the femur. And it makes its way on a diagonal, on an angle, and underneath that muscle is the sciatic nerve, largest, fattest, longest nerve of the body, size of my thumb. When that nerve becomes inflamed and irritated, we then start getting symptoms of burning, tingling, cramping down the leg. This piriformis muscle can stay contracted and shortened, always affecting on that sciatic nerve. Certain activities may make it worse. You may notice when you get up in the morning, you may be very stiff. As you walk around, it eases up. But the bottom line is the condition's there, and it's only going to give you problems. So I'm going to show you what would be very helpful for you to release that piriformis muscle. Now, to know where your piriformis is, what I'd like you to do, first, we're going to go ahead and work on the left one. I want you to bend your right knee, put your leg, cross your leg behind your right knee, and pull this up. And as you pull it up, you're going to say, I feel that in the left buttocks. Now, right in that area where you feel it, you're going to take your knuckle, the back of your hand like this, and you're going to lean over like this, and you're going to go ahead and take the knuckle and lean away and lean back onto that knuckle. Okay? And you're going to hold it there 15, 20 seconds. Then I'm going to have you lean away and come a little further in on that muscle and lean back over it and hold it right there. Now, you'll know when you're on it because the muscle will be sore. It will be real tight. It's a band. And the band runs from the outside of the hip right to the sacrum, runs on an angle. Okay? So it runs right on that angle. You're going to come along. You're going to feel a band under the buttocks. Okay? And you're going to go away here, take your knuckle again, and you're going to lean back on a little further in. Okay? Now, when you lean into that knuckle, let that knuckle pierce its way up into that muscle and hold it. It's called pneumo, or if myofascial, it's like a be able to release. It's just putting pressure on the muscle is going to release it like a trigger point. And you'll notice as you release it, the pain that you had will start to dissipate and it'll become a lot easier and it'll feel a lot better. Now, as you come across that muscle, don't be afraid to push in there. It's not going to hurt you. We're dealing with that piriformis muscle, and let your weight just fall onto the knuckle. So your knuckle is what's guiding the pressure up into that piriformis area. So I want you to make sure you know where the anatomy is. As you look at this chart, you can see exactly where it is. And I want you to understand where the piriformis is, because you can cross the leg, bring this up like this, and you'll feel that stretch in that muscle, and you'll have an idea exactly where it's at. So your job, if you haven't learned yet, is to know where the piriformis muscle is. Remember, it's the lower part of the sacrum, and it makes its way on a diagonal, attaching up on top around the hip area, okay, onto this joint right here, onto the bone, on an angle. The sciatic nerve runs underneath it. And learn your anatomy, because once you get in that knuckle and you work along that piriformis muscle, you will be amazed the difference and the changes of what your body can do. Because when the muscles contract and they shorten, if they stay shortened, they constrict and they affect nerves. They cause pain and inflammation. So that's a technique that's safe, very effective for all conditions. If you have a herniated disc, bulging disc, if you have spondylolisthesis, degenerative joint disease, it doesn't matter. We're strictly working the soft tissue, not affecting the spine. This is below the spinal levels and a very safe procedure. Now, if it's very painful because you have a lot of inflammation in the sciatic notch underneath, it's very, very painful, you might want to start using some ice. Use that for a couple days till the inflammation goes down, and then you can go ahead and work that muscle if you see it's necessary. Share this video, subscribe if you haven't, and most important, make it a great day. I'm Dr. Alan Mandell.